A Memphis doctor is helping patients heal while also helping students dream bigger. Dr. Winfred Abrams treats chronic pain as an interventional pain and spine physician. But outside the clinic, he's also mentoring young people across the Mid-South. ABC 24's Alicia Renee shows us how his mission is impacting lives and inspiring future doctors.
For Dr. Winfred Abrams, medicine is about more than treating pain. It's also about helping young people see what's possible. Every day he works with patients dealing with chronic pain using non-surgical treatments aimed at improving their quality of life, while also mentoring the next generation of healthcare professionals.
The first step is seeing someone and not waiting too long. We can help prevent them from getting worse and also reduce the current pain.
As an interventional pain and spine physician, Dr. Abrams treats conditions ranging from pinched nerves to chronic neck and back pain. Helping patients return to everyday activities is a mission he says is personal.
I was in the military and I have had a lot of musculoskeletal injuries, so if someone comes in with chronic back pain or knee pain, I'm able to empathize with them more.
But Dr. Abrams says some of his most meaningful work happens outside of the clinic. As president of Black Men in White Coats, he helps lead mentorship programs designed to expose minority students to careers in healthcare.
So we broke it down to elementary, middle school, high school, professional, collegiate. So we talk about how to set your goal, finances, and then also be able to answer questions, spend time with them, play some medical games. They have an annual meeting called the Annual White Coat Summit.
The organization visits schools across Memphis, connecting students with healthcare professionals. Dr. Abrams says their representation can help students believe those careers are within reach.
So a lot of students we meet, they've never had a black physician. There's a lot of health disparities, not only ethnic disparities, but sex, gender bias, and ethnic bias, and so it lets people know that you can do this.
And he says the impact is already showing. Some students who participated in the program have now graduated high school, entered medical programs, and are working toward becoming physicians themselves.
So often tell them, do what you need to do now so you can do what you want to do later. Persistence and adjustments and having goal setting is important. If you don't work, you don't get paid, but it's going to be a sacrifice on everybody's part, someone's part, to make a difference.
And when asked to describe the work he does for both patients and students, Dr. Abrams summed it up in 3 words:
impactful, meaningful, and rewarding.
Dr. Abrams says exposure and mentorship can change a young person's future. In Memphis, I'm Alicia Renee, and that's how we celebrate Memphis.